Overall case numbers rising here in Indiana. We are working to find out how local hospitals are preparing for a possible influx of patients. WRTV's Megan Sanctorum checked in with Franciscan St. Francis Health and IU Health to find out what they're seeing here locally.
It may be quiet outside of these two major hospitals in central Indiana, but inside, health leaders are hard at work. They're keeping a close eye on the number of COVID-19 cases and creating plans to make sure they can safely care for anyone who may need it.
Based on what we learned from the spring, when we sort of had this first surge, we were prepared at that time for an incredibly large volume of patients.
At IU Health's downtown campuses right now, they're not seeing an increase in COVID patients.
What we continue to do is watch the Department of Health's data around COVID-19, and throughout the state in the different counties, it is highly variable.
In fact, head a little south, and leaders at Franciscan Health say they are seeing more patients.
We have definitely seen an uptick. We were actually down to a pretty low level about 2 weeks ago. We've more than doubled since then, our inpatient.
But it's not all bad news. He says the number of people requiring a ventilator hasn't increased, and most patients are not getting as critically ill as they were earlier in the pandemic. But if that changes, they'll be ready.
Whether we need to cohort patients, dedicate specific units for the exclusive use of COVID. We've created a lot of extra rooms that have negative airflow capabilities. So I think we've certainly stockpiled more PPE to prepare for a surge.
IU Health also saying they're prepared.
What we're doing downtown on the Methodist Hospital and University Hospital campuses is looking at the spaces we have available and making sure we can convert them at any time to be whatever level of care or whatever type of space we need.
She says they've also looked at sourcing additional staffing. Both hospitals say they continue to learn more about the virus and the best way to treat COVID patients.
And we feel much more confident in our ability to know as things coming in what to do, how to treat them, and how to handle them.
Working for you, Megan Sanctorum, WRTV.